Hello, and thank you so much for joining us on today's edition of Kaleidoscope on Channels Television. I'm Anne Nwawadu. On the program today, we sit with the country director of the Bill and Melinda Gates Foundation, Dr. Jeremy Zungrana, to discuss how the foundation has been carrying out its intervention over the years, the existing challenges, and the impact it has made so far in Nigeria and Africa. We will also look at the annual CEO Forum the foundation conducted this year with other stakeholders in the food and nutrition sector in enhancing food fortification in the country. Once again, welcome to Kaleidoscope. The Bill and Melinda Gates Foundation is a non-profit that commits huge resources to a wide range of noble goals across the world to help people lead better and healthier lives, thereby driving a better future. Let's tell you more about its history, mission, and its vision. The Bill and Melinda Gates Foundation is an American private foundation founded by Bill Gates and Melinda French Gates, who both believe in giving back and being optimistic about the future. The journey of the nonprofit began in 1994 when it was first formed as the William H. Gates Foundation with a mission to fight poverty, disease, and inequity around the world. In the year 2000, the Bill and Melinda Gates Foundation was launched, and as of 2020, it was reported to be the second largest charitable foundation in the world. In the mid-2000s, the foundation's funding grew substantially to $2 billion, and on June 15, 2006, Mr. Gates announced his plans to transition out of a day-to-day role with Microsoft, effective July 31, 2008, to allow him to devote more time to working with the foundation. Riding on the back of the foundation slogan, "All lives have equal value," the foundation has spent billions of dollars supporting the promotion of sustainable development goals with major focus on health, education, gender equality, agriculture and nutrition, financial development, medical research, and much more. In the last 20 years, the Bill and Melinda Gates Foundation has supported the Global Vaccine Summit, which draws more than 300 participants, to endorse the critical role of immunization in saving lives and recognizing accomplishments. It also organizes an annual Goalkeepers event, which provides a platform to recognize and reward individuals making a difference in their own capacity to achieve the United Nations Sustainable Development Goals. Guided by the belief that every life has equal value, the Bill and Melinda Gates Foundation, under the direction of co-chairs Bill Gates and Melinda French Gates and the Board of Trustees, is determined to ensure more children and young people survive and thrive, empower the poorest, especially women and girls, combat infectious diseases, and inspire people to take action to change the world. Let's now hear from the country director, Dr. Jeremy Zungrana, on the foundation's activities. The Bill and Melinda Gates Foundation started operations in Nigeria back in 2010. And over the years, you've been working across health, agriculture, financial development, nutrition, and recently gender equality to support all of these fields in the country and also supporting the Sustainable Development Goals. How would you describe the journey of the foundation so far since you started?
Thank you so much. I think I will say it has been a very great journey because, since the beginning, you may have missed one important point that the foundation find a reason to be in Nigeria. It was about the white polio virus. And we started with this big challenge in the northern part, mainly on the northern part of Nigeria. And last year, I will say 2 years back, we celebrated the end of the white polio virus. In addition to that, I will say that the foundation has been able to push a lot of on policy level. Our slogan is all lives have equal value. So we are fighting to make sure that people have healthy and productive life on whatever we are supporting. Should be health, agriculture, financial inclusion, gender, to ensure that we have the most equitable society where we can continue to support. I will say we still have challenges, but I will say we are on track in terms of commitment and partnership with different people in Nigeria. So far, so good.
So let's begin with health, since you're a health sociologist and I know you're an expert in large-scale health programs across sub-Saharan Africa. What do you think is the answer to the health challenges confronting Nigeria and Africa at the moment, and what do you think should be done in carrying out intervention? What has your foundation done so far in interventions in the health sector in the country?
Very interesting question. I will say it's I may not have one answer covering everything, but I will say on health currently, one of the biggest challenges that I will say is health financing. Everything around financing is a big challenge, and I will give you some example in Nigeria. First of all, out-of-pocket payment. That means if you are sick and you need to seek for help, you will be paying up to 70 to 80% out of your pocket. So meaning that it is a big burden for those who are seeking for help. This is number one, meaning that we need to have a lot of support from the federal government, from the state, from the private sector, and then from individual to support taking care of the health. But the second thing, we know that primary health care is number one pillar where we have more than 70 to 80% of population going there when they are looking for help. But this is the area that is under-financed, and the quality also is not there. So I think they are two correlated, and I will say that. Then we have the secondary and the tertiary level, where apparently they are the most absorbing a lot of the funding, but the quality also is not there. So if I want to summarize, I think we need to ensure that in addition to the good policy that we have a proper health financing mechanism supported by the government, partner, private sector, and then the community, down from the federal level to the community level, where we have enough human resources for skilled health care provider, enough life-saving drug, medicine, equipment, and also close to where people have. If you take any single woman in some part of Nigeria, they still not have access to skilled birth attendant. They have to deliver at home. And we want these women to be able to deliver at the health facility where they can get adequate care. Some of the intervention, as I mentioned, so if I take the health financing aspect, we have what we call, we are working on advocacy level for the government, working with different institutions for them to be able to support health financing in Nigeria. We are supporting the BSCPS. This is another mechanism where the government committed to allocate 1% of the collective revenue to support. The foundation is supporting this mechanism to make sure that the funding is going down to the state level. In addition to that, we have a different platform where we are working with the Nigeria Governor Forum to continue the advocacy at this level. We are also providing some incentive to the government, and we have one innovation for financial system where we are providing some funding every time that the government is putting more money into the health sector. This is another way of innovation, incentive. But apart from that, we have MOU, Memorandum of Understanding, with 6 states to support them with the minimum package services so that they can deliver what we're expecting for them to deliver on maternal, newborn, child health. In addition to that, we are granting many partner NGO, international partners to support Nigeria in delivering what need to be done at different spectrum of health need in the country. So it is still ongoing. Our support is both at the federal, state, but also at the community level. We have a lot of projects that probably I will not be able to name here, but there are over 100 of them. So, in the COVID area, the foundation has been supporting COVID globally. So some of the labs that have been able to develop vaccine, most of them and some of them has been supported by the foundation. And this is what we call global good. We are supporting a lab to develop, to try, and we are lucky that, happy that during the COVID time, some of these lab supporters have been able to generate and create vaccine. The second aspect, the foundation was at the front, I will say at the front to ensure vaccine equity distribution. We supported COVAX mechanism to make sure that African country and all other countries, Asia, have access to the COVID vaccine. Unfortunately, the plan was not what we expected because, you know, we saw a lot of vaccine nationalism and so on. But today, I think every single country have require vaccine, and what need to be next is to ensure that we have vaccine in the hand of everybody. So I think vaccine remain a very good tool to prevent disease, and I want to use this opportunity to really call everyone to go for vaccination because this is the only way for us to continue protecting ourselves. Vaccine hesitancy is another challenge, and we know that with the media, mass media, we can have a lot of misinformation about vaccine. And we noticed that there was a time where we were really all crying to get vaccine. It was even not possible to get the vaccine. Now that we have vaccine, we notice that many people are not queuing to go for vaccine. And they may have some reason to not go for it. But I think the foundation together with other partners are developing program to get close to client, to the people, so that we can address any concern, rumor, miscommunication about vaccine hesitancy. But another way of addressing vaccine hesitancy is also to get vaccine close to the people, because I'm not sure that we are doing enough to cover, you know, people with vaccine. I'm not sure we are opening Saturday, Sunday, extra time for those who are working to go to get their own vaccine. And this is something that the foundation is thinking innovatively to propose so that we have access to vaccine anytime you want, wherever you are, so that we get a good coverage. Otherwise, vaccine is disponible, available, and we need people to get it. We still need to continue the polio because, you know, even though we no longer have white polio virus, we have what we call the circulating mutant polio, and this is when you don't continue the routine vaccination properly and you get the low coverage, you can still have these kind of cases. So our invite is for states to continue with routine immunization to cover properly. For the mutant circulating polio, there is a vaccine for that, and they are doing a lot of campaign to catch up. And I'm sure that with the support of the Federal Ministry of Health and NPCDA, we will continue to reach there. So we should continue.
We continue to celebrate women across the world every day. Is the Bill and Melinda Gates Foundation doing anything to promote gender equality, and how important is gender equality to your foundation?
Promoting gender equality is highly important, and it is one of the sectors that is integrated across all investment. For the Bill and Melinda Gates Foundation, every single investment need to be from gender intentional to gender transformative, meaning that you need to address any gender issue. Why we are doing any investment, any project, call it, name it. So gender is another way of addressing inequity. And we also know that most of the problems that we are talking about, majority of them are linked to women, are linked to gender. So you cannot address a single problem, should be agriculture, health, without thinking through the gender lens so that you can address and promote more equity for people. So I will say the Bill and Melinda Gates Foundation do support the government through different global levels to really push the gender agenda in Nigeria.
When we return, we'll find out what the foundation is doing in partnership with other stakeholders to ensure better nutrition in Nigeria. Stay with us. Welcome back. You're still watching Kaleidoscope on Channels Television. Dr. Jeremy Zugrana and I continued the conversation, but this time on food fortification in Nigeria, which the Bill and Melinda Gates Foundation has been promoting with the annual CEO Forum in partnership with major stakeholders in areas of health, trade, and nutrition. While the event was held this year to see the progress made on the need to have healthier foods in Nigeria, let's bring you highlights of that event before we continue the discussion.
The CEO Forum is an annual event organized by 4 major partners: the Bill and Melinda Gates Foundation, the Aliko Dangote Foundation, TechnoServe, and the federal government of Nigeria to drive the importance of food fortification of staple foods in Nigeria. It provides a platform for stakeholders to see the progress made so far and proffer solutions to malnutrition in Nigeria. From deliberations to challenges and solutions, participants express their views on the subject.
The reality is Russia and Ukraine are number 1 and number 5 in wheat production. And if you take that volume, which is almost 1/3 of the total wheat production in the world out, there will be an immediate impact on pricing. So as of today, prices of wheat have gone up. Now, there's a lag in the system that comes because of inventory controls and inventory management, but it is something that we need to be sitting down with government today to discuss about what measures can we put in place to alleviate what is coming down the road. And the impact is not just on wheat, by the way.
NAFDAC is already setting up a regulation. Fats and oils regulation is going through the Ministry of Health right now. Before it is gazetted, we have to have more enforcement and to have sensitization of the community in terms of even the amount of oil that should be consumed. But more importantly is the regulation that is in the works right now to ensure that we are very sensitized to the damage that trans fat can have on the cardiovascular system.
We shall do all we can in the health sector to support all initiatives to improve access to micronutrients and support the industry. But I do understand also that the idea should also come to some industrialists to say, well, let us find how we can manufacture these micronutrients locally. Because with our own population of going to 214, 215 million, and perhaps the entire market of West Africa, opportunities exist to also say, well, why don't we go into production of these APIs or all these things instead of relying absolutely on importation?
This forum is very, very important in that it has given government an opportunity to hear from the stakeholders. When the comment was being made with regards to increase in import duties for the fortification that is used, I had a short whisper to my colleague, the Minister of Health, and we have both agreed that we will take this request to our colleague in the Ministry of Finance with a view to seeing that what we can do. So, like I said in my comments earlier on, government will continue to do its best to support this initiative. We appreciate what you all are doing for the country, and you can rest assured that we will continue to support you.
I plead with all the players to please help in terms of trying to achieve our targets. It will be very embarrassing if we now come back next year and we are now below 90%. So please let us now have it as a commitment to make sure that, yes, we will reach that target. And I'm sure you share my own views. We all have commitments, right? I didn't hear yes. Okay, fine. So since the regulators are here, the honorable ministers are here, we've given our commitment that it will be much, much better by next year.
In the last 4 years, the forum has experienced increased engagement by the federal government and CEOs of Nigeria's largest food processing companies, resulting in years of steady progress, and they hope to continue to do more to achieve their goal.
So I asked Dr. Zungrana what the foundation and its partners are hoping to achieve with the annual program on food fortification in Nigeria and what should be done to ensure we get it right and reduce stunting and malnutrition.
I think this CEO annual forum is a very important one when we understand that we need industrial CEO to contribute to fight against malnutrition, understanding that, you know, to serve the largest population, we need to ensure that most of the staple used in the country are well equipped with mineral and vitamin. You know, if you don't have them in your body, in your brain, will suffer or deprive from what is key for the development, and it is linked to the development. So this annual meeting offers opportunity for the CEO again to see how the progress was made in terms of food fortification, you know, on salt, on oil, on sugar, on wheat flour. And then from there, what are the challenges and what do we need to do, you know, to ensure that we reach the target at least 90%. And also appreciate their contribution because, you know, usually industrial are looking for business, but combining the public health perspective to ensure that the poor people, you know, poorest are also benefiting from this product by just adding some mineral and vitamin for them free of charge. I think it's a good opportunity to appreciate their effort and also, you know, ask them to do more because it has not been always, you know, great across all the product that we are talking about.
So we keep emphasizing the need for diversification in Nigeria from oil to agriculture. Is the Bill and Melinda Gates Foundation doing anything to help government promote agriculture in the country?
Yes. Agriculture is another very important sector, and by the way, agriculture is linked to nutrition. We want agriculture to be supporting nutrition, and you know that when we talk about agriculture, we talk about from production. We call what we call value change. So it's not about producing, but you have to be able also to transform. But if I take the production aspect, you need to be able to have a high yield productivity. So the foundation is in partnership with many universities here conducting a lot of research and development to make sure that we have some high yield product for cassava, maize, and rice. In addition to that, for the value chain market aspect, how can we support the small or the farmer for them to be able to not only get something, good productivity, but also return on their investment. So in couple with the nutrition, I think we have a lot of plan where we are talking about digitalization, being able to predict the climate change, how do we support the agriculture. And 2 days ago, I was with the Federal Minister of Agriculture and Rural Development, and there is a good vision to continue supporting Nigeria developing its integrated transformative agriculture.
You assumed office as Nigeria's country director for the Bill and Melinda Gates Foundation in January 2021. I mean, 1 year gone already. What's your experience been like when you compare it to where you were coming from Tanzania?
I will say it's the 1 year passed so fast, and meaning that it was good, even though I started in the context of COVID-19. But I have to say that Nigeria is unique. You cannot compare Nigeria to any country. But let me also be straight that I found in Nigeria fighting, being really honest on the way of addressing things. And the commitment is there, the willingness is there. And, you know, from the leadership perspective, I can say you will never see somebody who is against development. They are all pro-development, they want to advance. Now, it is a country who have a lot of challenges, and probably we need to rethink about prioritizing some of them to see how we can advance. So it's 1 year, probably it's too early to say something, but I am optimistic the way I'm seeing commitment from the leadership level that something will change and Nigeria will be the leader of Africa and continue to be the leader of Africa, because if we change Nigeria, definitely we will change the rest of Africa, and we count on Nigeria for that.
Going forward, especially under your leadership right now, what would you be doing differently, and how do you plan to promote the foundation strategy and improving your local presence in the country?
Yeah, thank you so much. I think going forward, we want to ensure that our priority remain on top of priority. Human capital development has been one of them. And when we talk about human capital development, you talk about health, you talk about education, you talk about youth employment, etc. So we are pushing the human capital development agenda, from federal level to the state level. We have a big support at that level. Then the primary health care, strengthening the primary health care, where I mentioned to you that 70% of population are using services there, is another area that will continue to push. We also know that malaria is one of the first or second killer, almost 100% per year. So we need to continue investing on malaria. And on the health sector, maternal, newborn, child health, mortality is another issue that we need to continue supporting. But the way we support is really helping somebody to be able to support itself. We don't do at the place of people. So we, together with our partner, because we are only a portion of other development partners. So together with other development partner, government, and state leader, we will prioritize some of this agenda to ensure that our slogan of all life have equal value continue to be through our investment, through our support, and our priority remain the same. As a foundation, we remain committed to work with the government and all stakeholders to ensure that our priority on health, agriculture, financial inclusion, gender are on top of the priority. Together, I'm sure that we'll be on track and the future is more positive than the current one. Thank you so much.
And that's Kaleidoscope for today, as we continue to encourage organizations to do more to help the society. Thank you so much for watching. Please remember that you can watch past editions of the program. Go to youtube.com/channelsweb, click on playlist, and then scroll to Kaleidoscope. Stay safe. I'm Anne Mwawadu.